Well, Dr. Hazel Carney is a feline health and behavior specialist with 30 years of experience caring for cats. Welcome to the show, Dr. Carney.
Hi, Robert. Thank you for having me.
Well, it's a pleasure to have you here. Now, we're going to cover two subjects with you today. First, I'd like to talk to you about feline hyperthyroidism, which I understand is one of your specialties, and then behavior issues with cats around the holidays. So let me first ask you, explain what exactly feline hyperthyroidism is for people who are unfamiliar with it, and does it only occur in senior cats?
Feline hyperthyroidism is a group of clinical signs seen in any cat whose thyroid gland begins to overfunction. It occurs primarily in senior cats, although cases have been documented in cats as young as 4 or 5 years of age. The majority, however, do tend to be somewhere above 10 and quite often above 13. And what they do is, because the thyroid gland regulates the speed at which all the other functions in the body run, when the thyroid gland starts overfunctioning, everything in the cat's system basically speeds up. So what an owner sees is evidence of this high-speed activity. We get the old cat that's been a couch potato all of a sudden beginning to play like a kitten. They're running around. They've been on a diet for years, couldn't lose an ounce, and all of a sudden they're losing weight in spite of eating more. They're drinking more. Some of them will talk in the middle of the night. They'll get up, they'll wander around the house and just give an owner what for. Others will quit sleeping in the sun and start looking for the tile floor, which seems cold to the owner. So there are lots of different manifestations that the owner will see.
That's interesting. Now, when these symptoms occur, are they early signs or signs of advanced cases?
The astute owner will often pick up on early signs such as just a little bit more activity. They may actually begin to see the cat drink, because it's in the typical situation, an owner rarely, if ever, sees its cat drink water, unless the cat likes to drink from an unusual location. So they'll start to notice just little things. The average owner more commonly begins to wonder what's going on when the cat starts to lose weight, or when the cat starts to talk quite a bit in the middle of the night.
Now, is this disease curable or preventable?
It is not preventable, because we do not yet know the exact cause of the disease. There are theories related to iodine content of foods that the cat eats. There are environmental contaminants which may influence the progression of the disease. For instance, we can induce changes in the cells in a laboratory by exposing them to a common flame retardant that's used on furniture, on children's sleepwear, but of course nobody has given those directly to the cat and produced the disease. But we do also know that some of the byproducts of these chemicals are at a much higher concentration in the urine of cats than in cats that aren't exposed to them. So there are some loose associations, but we definitely, we can't prevent it so far as we know. We can, however, cure it or effectively manage it depending upon what else is going on in the cat's physical situation.
Mm-hmm. Now I read that there's one treatment, I forget now what it's called, but it's a shot of, was it radiated?
It's radioactive iodine therapy.
Okay.
And you use an injection, or in some states it is acceptable to give the drug orally, of radioactive iodine 131. And this drug then is taken up by the active thyroid glands, because to produce excessive thyroid hormone, the thyroid gland needs more and more iodine. When it takes up the radioactive iodine, then the radiation directly kills the abnormal cells, and that cures the disease. And the success rate, especially in cats that already have disease in both sides of their neck with two thyroid glands involved, is about 98% success.
Now, is this a tumor that is being treated?
It is. It's a non-cancerous tumor in the majority of the cats. And if the disease goes along, for a couple of years, many owners will actually begin to see or feel a lump in one or both sides of the cat's neck. Most veterinarians that work with older cats feel the neck of the cat at each annual examination, and they can pick up a much, much smaller tumor than an owner would detect commonly.
So for those listening, if they're concerned and want to find out, if for whatever reason they might be suspect that their cat is suffering from this, they can feel their cat's neck to search for a lump?
Well, they can do that. The easier way is to take their cat to their veterinarian and have a simple blood test performed, which will diagnose somewhere in excess of 90% of the cases of the disease. And it's part of the routine senior care blood panel that is recommended by the American Association of Feline Practitioners.
I see. Now, so is this radiated iodine shot then the most effective treatment used? And there are other treatments available too, right? I mean, there was, when I was posting this on the radio show's Facebook page, one of my followers who said that their cat suffers from this said that they were unaware of this type of treatment, and their vet had prescribed some kind of oral medication. So she was going to ask her vet about this to see if this would be a more effective treatment. But what are some of the other treatments that vets prescribe for this disease besides the shot?
Part of the consideration is that not all states have an approved radioiodine treatment facility. So it may just be that it's not available in her area, which is why our veterinarian didn't recommend it. And there are, however, oral medications that effectively control the disease, and surgical removal of the enlarged thyroid glands is also an option. Under what
circumstances would you remove the gland as opposed to not removing it?
If the cat cannot tolerate the oral drug that controls the disease effectively, or if there is evidence that this cat's tumor may be cancerous, or if the tumor has been present for several years and is enlarging and interfering with the cat's comfort in either swallowing or being petted on the neck, all of those are considerations that might suggest the need for surgical removal instead of either oral drugs or radiation.
Now, is there any disadvantage to having it surgically removed? Does it change the quality of the cat's life at all, or?
The biggest concern with removing the thyroid gland is if you take out only one side, the other side will very commonly become hyperfunctioning within 6 months to a year after the surgery, so the cat would need a second surgery. If both glands, however, are removed at the same surgery, then there is a problem because a second gland, called the parathyroid gland, lies just on top of the thyroid gland. And if the parathyroid gland is suddenly removed, the cat's body can no longer control the calcium balance in its body. And without calcium, then the cat will develop severe muscle twitches all the way to seizures and have a lot of trouble controlling its heart rate as well. And so a cat would have to be managed until either a little bitty cell of the parathyroid becomes, regrows and becomes active enough, or they use drugs the rest of their life then for calcium management.
I see. Well, I can see then how a medication of some sort would be preferable to. It sounds as if the removal of the gland is a more due to more serious circumstances involved in the cat's health, right?
Well, now that radioactive iodine is fairly commonly available, yes. Surgery was originally one of the more common therapies. And some veterinarians are very, very comfortable doing the surgery and have good success with it. But others, we do always have the possibility of using drug therapy. One of the other concerns with surgery, and in fact with radioactive iodine, is that neither one of them are reversible. So that if the cat actually needs some level of functioning thyroid tissue, by doing either of those procedures, we can't provide that for the cat. And so in those situations, sometimes the cat actually will do better on the oral medication because you can kind of control the amount of thyroid hormone that is produced and manage the cat's symptoms effectively.
Hello, caller ending 5707.
Hi there. This is Susie in the San Francisco Bay Area calling up again to
Susie.
speak with Dr. Carney. Hi.
Hi, Susie.
Hi there. I do have a 17-year-old cat who is on daily medication for hyperthyroid.
Right.
This news of the radioactive iodine is new to me. I had not heard it before, and I'm wondering, do you happen to know if it's available in California at this time?
Yes, California was actually really the birthplace of routine radioactive iodine therapy. I am familiar with at least 3 facilities in the state of California that do the treatment procedure.
Okay, is that something I can maybe look up online then, just by
Yes,
typing
I'm
in
sure
radioactive iodine, California?
And you'll find the treatment center that is closest to you.
Well, great. Thank you. I definitely want to research this to see if it would be a good treatment for my cat. I mean, right now I give her medication through a transdermal gel, which is easy enough, but it'd be nice to not have to do something on a daily basis as long as it's safe for her. So, great.
Right.
Thank you.
Good luck with her.
Susie,
so much.
Susie, how long has your cat been on this treatment, had this condition?
Well, actually, I adopted her about a year and a half ago, and she was already a senior cat with the condition, and that prevented her from being adopted by, other families. So that's kind of why I took her in. I thought, well, no one else is going to take this wonderful cat just because of this one problem, then I will. So she's with me now.
Now, since
one thing to consider, Susie, is the longer a cat is hyperthyroid and on the methimazole treatment, the greater the concern that the tumor will become malignant. So looking into the I-131 is very wise from that standpoint as well.
Okay, very good. Thank you so much for this information, Dr. Carney.
Sure.
Okay, thanks. Have a great day. Bye-bye.
All right, well, thank you for calling in once again, Susie. Now you indicated that there are some theories that diet plays a role in all this. Can diet also play a role in the ongoing treatment of this disease? I mean, should someone change their cat diet at all if they have this condition?
Actually, we do now have a specific therapy that utilizes one prescription food.
Okay.
The food is made by Hill's Pet Nutrition. It's in their prescription line. It is called YD, Y for hyper. And what it does is it totally restricts the amount of iodine that a cat eats. Consequently, the thyroid cells don't have that iodine that they need to make excessive hormone. The diet can be very effective in individual cats. It comes both as canned and dry formulations. The biggest drawback to its use is it can be absolutely the only thing that the cat eats. And in fact, some cats that are on the diet also need even bottled distilled water because the local water source contains too much iodine and will interfere with the diet's effectiveness. But it's one of the newest ways of treating the disease.
Interesting. Now, what about those people who may be feeding their cat a straight protein diet, raw or cooked meat? I've started feeding my cat just raw or cooked chicken and fish and chicken livers and gizzards and so forth. Is that a smart thing to do for a senior cat that may or may not have this condition?
Unless the diet that you are feeding has been documented to provide a nutritionally balanced profile, it can definitely cause more harm than good. And the protein source dramatically influences the iodine content of a diet. For instance, a fish-based diet is much more likely to have a higher iodine content than some of the poultries would have. But you could not, as a cat owner, probably develop a diet that definitely you could probably not develop a balanced diet that would treat hyperthyroidism. And unfortunately, because we don't know when in the cat's life the iodine content is most important in possibly inducing hyperthyroidism, starting a food now may make no difference in the long run unless you have just a youngster. Because we know that the biological changes are going on in the cat's body sometimes 2 to 3 years before you start to see any of the clinical signs.
And the biggest culprit really is the iodine content.
Well, we're not certain of that. That's one of the more, based on what we have as epidemiologic studies and tissue studies, that's one of the more realistic possibilities as to a cause. If we go back historically, the actual iodine requirements for pet foods that have been issued by the food governing group have changed over the years. And based on the changes that they have recommended, it's probably affected the thyroid function of cats at different stages in their life.
Well,
so it's just one of the theories. Definitely don't jump on just food. But we do know, for instance, that, interestingly, cats that eat predominantly canned food do have epidemiologically a higher risk than cats that have eaten mainly dry foods. We also have some genetic influences in the development of the disease. Interestingly, Siamese and Siamese cross cats have a lower risk epidemiologically than do the non-Siamese. Your domestic short-haired alley cat has a higher risk of developing the disease. So we have genetic influences. We also have the lifestyle influences. One of the epidemiology studies actually showed that cats that used cat litter had a greater risk of developing the disease than those that didn't. So we really don't have the answer as to the cause.
Now, how would a cat not use cat litter? You mean if they're...
Well, it would be the cat that's primarily, that's an outdoor cat that uses garden soil, for instance.
And they have a lower risk than those using...
than cats that were, confined and used litter in one epidemiology study.
Wow. Yeah, that is kind of strange because in most cases, people, professionals feel that cats face many more health risks if they're an outdoor cat than if they're an indoor cat, but
right,
not
exactly. And we don't know that, it was specifically the litter. It could have been something else in using a litter box may have simply indicated that those cats were confined more than non-litter using cats. It could be something in the litter itself. It could be something in the cleaners that are used in the litter box. The studies just are not available to give us all the answers.
Well, if someone suspects that their cat may be suffering from this disease, or or suspect of it, or if they've discovered that they've been diagnosed with this problem, should people be fearful about this?
For themselves or for the kitty cat?
For the cat more than the person, I guess, but either one. I mean, I suppose.
Well, it is the nice thing about the disease. It's one of the very few diseases of the older cat that we can cure, and cats are definitely healthier and happier if they are not hyperthyroid.
but it's not necessarily. I mean, it's not life-threatening as long as it's treated or managed. It doesn't really pose. It doesn't shorten their lifespan or affect their quality of life to any great extent. Is that what you're saying?
It affects the quality of life if they are not treated significantly, because they are. They're just a antsy, hyper, unkempt, agitated cat whose heart tends to be running a mile a minute, which kind of scares the cat. So they definitely have a much better quality of life if they are managed. Long-term management on the drug cats that are on the drug therapy long-term also do not seem to have quite so good a quality of life as those cats that have received radioactive iodine or surgery and have been cured of their disease, because the drug itself has some potential for significant side effects.
I see. So well, that's what I was going to ask you about, because you mentioned that the disease is curable, but at the same time there can be long-term management of it. So if it's being managed long-term, does it ever come to the point where it's cured, or is it just something that has to be managed for the rest of the cat's life?
With oral medication, the disease is never cured, nor would it be cured with the food as a therapy either. The only way it can be cured is with surgery or radiation therapy.
Then using radiation therapy or surgery, well, with surgery, I guess there's just a fairly short recovery time or something. But with the radiation treatment, how long typically does it take for the disease to be cured using that therapy?
Physically, cats begin to act much more normally within 3 to 5 days of having been given the radiation. They are dramatically improved within a couple of weeks. Now, about 95% of them have their thyroid value in their thyroid level in their blood drop to normal within a month after the radiation therapy.
And then once it drops down, does it stay there?
Yes, it stays down because those cells, the abnormal cells, have been killed by the therapy.
I see.
A smaller group of cats take up to 6 months for the hormone level to drop to completely normal. But there again, most of them look, if you just look at the cat, they look as though they have a normal thyroid level again, because they regain weight, their coat gets back to being pretty, they act like they're supposed to for their age, they are comfortable acting and feeling.
Okay. All right. Well, it sounds as if this radiation therapy overall is really the best solution. I mean, I don't know if there's not a particular reason why it shouldn't be used on a case-by-case basis. I don't know why anybody would not want to use it if it really cures the disease, so that the cat can then have a normal life. Why is it not allowed in some states?
It has to do with radiation regulations within individual states. Some states are very restrictive in how long a cat would have to be isolated after the therapy before it can go home, so that if you have to hospitalize a cat for somewhere close to 3 to 4 weeks after a therapy, owners would be very hesitant to do the treatment. In those states where we have to keep them, say, only 3 to 5 days, then it is definitely considered the gold standard therapy, where it's available with reasonable lockup for the cat while they're radioactive.
I see. Now how expensive are these treatments?
Well, interestingly, if you look at the cost of treating hyperthyroidism over the lifespan of the cat, the cost for radiation, oral medication, or bilateral surgery is the same. It's just spread out differently in how you pay for it. So that if the cat's on oral medication, they need routine blood testing, etc., as well as drug cost. If they have surgery, they pay for the surgery, usually 2 surgeries a month apart. If they pay for radiation, it's a one-time charge for the therapy and the hospitalization that goes with it. So around the country, ballparking the cost of any of these is going to be, all over the country there's a huge variation, but probably you could say as little as $800-900 up to $1,700 or $1,800 around the country. Now, we used to say that we didn't have any difference. With the advent of the YD food, because that food will have to be fed for the remainder of the cat's life, it will ultimately be much more expensive than the other 3 therapies.
All right. Well, it sounds if it's not too horrendously expensive. I appreciate you shedding some light on this issue, on this condition. It's something that I really didn't know very much about, and I really appreciate it because I have a cat that's 12 years old now, and I know he's getting up there in age, and I worry all the time about what kind of issues I'm going to be facing in the coming years, and how I can make my cat live a very comfortable quality of life for his remaining years. And if this should ever come up, I feel comfortable now knowing that that there is a bright light at the end of the tunnel to make him comfortable in dealing with this condition. So I appreciate that.
Well, good. No, it is a very rewarding disease to treat in that we can give them so much longer, healthier life, which often we can't do with older kitties with some of the diseases that they come up with.